Hi guys, welcome back to EMS clinical scenario with Joseph, yours truly, emergency medical technician certified. So today we are gonna go over an interesting case, one that I actually have had before, or have I? But either way, I know what to do in this case. So I'm gonna go through it with you. So you've been dispatched priority 1 ALS for, let's think of the age, 54-year-old male, alter mental status unknown, said by dispatch. So here's what's happening. From dispatch, your patient is supposedly alter mental status, unknown causes, unknown changes per dispatch. Because it's priority 1 ALS, you are going to be expecting a paramedic en route if you don't have one with you already. So, let's say you arrive scene, you don't have a paramedic with you, and you enter the patient's living room. The patient is just sitting there. Alter mental, does not know what's going on, cannot tell you anything, so you cannot ask them the alert and oriented questions. Let's suppose you try, and they're not able to tell you their name, or they start slurring their speech doing it. Here's what you're going to do first. After you do your BSI and your initial view assessment, you are going to perform a stroke scale. Because if the patient is alter mental, slurring their speech, you're going to want to get the stroke scale done. Because the first thing you are going to want to suspect is stroke. Because suppose you don't have a medical history given. You have no history to help you. And you want to cover your bases first. So you do that. And patient is slurred their speech. They are still alter mental status. They are not able to comply with the stroke scale. So, like for example, if you ask them to smile, they're not able to do that for you. You have them raise their arms and have them raise their arms in the air and close their eyes to see for arm drift, or check for facial droop. If you're able to check balance, probably if it's safe to get them up, but depending on the case, you may or may not want to. That is situation. Check the eyes for sluggish as well, sluggish eyes, and you do your stroke scale. You also have them try to repeat a phrase if you can't do that. So you suspect stroke. What you're also going to do is take a blood sugar, because that is the second cause, hypoglycemia, which is low blood sugar. And suppose your patient's blood sugar comes back at low, to the point where your glucometer can't even read the thing. So you sort of get a picture of why your patient is severely alter mental. In that case, your patient could be at risk for a coma, seizures, sometimes they even have stroke symptoms like that. Sometimes they can have a stroke, which is a risk of that. So, hypothetically, so you're the BLS team member. You're the BLS member, the EMT basic. So you don't have a paramedic on scene yet. What you could do, you're going to want to get oral glucose. However, only if the patient is alert enough to swallow the oral glucose, be able to swallow the oral glucose. If your patient is not that alert, like if they are not even able to understand what you are telling them, do not do it, because they will aspirate, they will choke. You do not want that. However, you're going to want the medic, because they can always give glucagon via IV and give fluids if needed, if you cannot get oral glucose. Sometimes if the patient has family, sometimes they will have administered a glucagon shot, which will definitely raise the blood sugar if they have injected it prior to EMS arrival. But even if they injected it, they are still have to call 911 because the patient is still critical until the point of their blood sugar rising. They're not out of the woods yet. But yeah, this is one of the things. Yeah, rule out altered mental status, stroke, hypoglycemia, any other possible things in their history that may contribute to that. Ask about medications, rule out drug stuff, because if the patient took something, then that can cause like altered mental status depending on the drug and depending how much they took. Seriously. It's happened. It could happen. Anything can happen, really, but you gotta cover all your bases. Then you're gonna want, obviously, get vitals if you haven't done already. Do a full physical exam if you haven't done already. See if there's anything else you need to rule out just to cover the bases. And then continue on with your treatment plan. Get ready to transport, most likely with the medic, if the medic feels that they need to ride with them in that case, to the hospital. And then just go from there. So that's another medical scenario with Joseph, certified EMT, tonight. I hope to continue posting more videos about medical experience and many scenarios. Okay, guys? See you on the next EMS clinical scenarios with Joseph.